Hello, my name is Jill Bray-Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. Our goal is to provide you with some great education on available services and help you become a more informed consumer of healthcare. With healthcare reform upon us, there is challenges and opportunities to face as a community. In partnership with our community providers, we take great pride in serving Franklin and Grand Isle counties and want to be your trusted healthcare resource as we transition the healthcare delivery system. Today, we welcome Dr. Leonard Tremblay, who has been practicing obstetrics and gynecology for 22 years. He is part of Northwestern OB-GYN, and that's a practice of Northwestern Medical Center, and it's located on our campus in the Doctor's Office Commons. There's so many things that Dr. Tremblay has accomplished, but we're going to talk a little bit about a program today because he's been instrumental in the development of this program, which is a new approach to prenatal care at Northwestern Medical Center. So Dr. Tremblay, thank you so much for being here
my
today.
Pleasure.
So I can't wait to talk about healthy beginnings. And so how did healthy beginnings get its start?
Well, you know, the concept of group visit is not new. I think it's been tried and shown to be very effective in the management of chronic disease like diabetes or hypertension. And when you think of it, it makes the most sense for prenatal care. Typically, prenatal care is a series of 14 visits. Women come with their partner to the office. We have, even if you take a lot of time, about 10 minutes where we measure blood pressure, check the baby's heartbeat, that type of thing. So the concept of a group visit gives us an hour with a group of women who are sharing the same experience. So we have a lot more time to discuss topics that may be important to them and not necessarily what we think is important to them. So it involves the patients a lot more than the usual classical prenatal visit. It gives us time to cover a lot more topic in the message. By example, when I talk in the first trimester, we talk a lot about weight gain and exercise and diet. So instead of having 5-10 minutes and repeating the same message to 10 people during the day, you have 10 people, you have 1 hour, you have time to do a real conversation. You can go in depth in the topic, and women to women also have questions or experiences that are really different. So it empowers people to get the knowledge that they really want necessarily about prenatal care. So it's very, very neat. It also gives you a chance to know people better, because when you have 5-10 minutes, you know what it is. I mean, if you go on a date and you have 10 minutes, you don't know the person, but you have an hour at least you can spend time. So it gives us a chance to know people better. They know us better. They have a chance to, because the program takes place at the birthing center. They also know our hospital and our birthing center better. So it's very, very interactive, very dynamic. It's a better way of doing prenatal care.
So would an individual have a choice of doing that, or how do you get that promoted as the best way to do it and preserve, because I mean, you're my doctor, this is a pretty special time in my life, and so how do I get time with you too?
Well, actually, very good point. In the program, there's a private time that's built in. So a typical class, let's say that we have 6 couples who come, we have an area that is private where we still do the same classical visit, where we do check your blood pressure, the fetal heart rate, and there's a time for a few minutes of private interaction, and then we go into a group visit, so that's the same thing. And of course, we always give people choice, although we highly favor that approach. And the program is built that we have 1 group visit per trimester, so there's 3 group visits during the whole pregnancy, and the rest are regular visits in the office. So it's a combination of the both, so you have a chance to participate in both. We've also built in something that I think is very neat, that we're just now starting the first group. It's a 2 weeks postpartum visit, because many of the postpartum visit or problems start early, and classically we're doing visits 6 or 8 weeks after birth. Seeing a new mom earlier, 2 weeks after, give us the opportunity of much earlier intervention. So I think it's also a much better way of doing prenatal care.
So postpartum, so after the birth, do they come together as a group?
Yes.
Again?
Yes.
So that must be helpful for the group because they must have a lot of questions.
Actually, I can't tell you too much about it because our first group is next month. So
Oh,
we're just getting to there.
So this is really a new
this
program.
is very, very
yeah.
new, but the potential is great. Obviously, I mean, my vision is we're going to be able to see women coming with their baby, comparing notes, and 2 weeks after, I mean, you know, when you have children, breastfeeding issues are very common. It's very overwhelming to raise a child. So having a group of women together at 2 weeks after they have a baby in the same room, sharing experience, I think has the potential to really make life better and easier. But it's really a neat way of doing the prenatal care.
Yeah, sounds pretty cool.
Very exciting.
So, you know, young, probably working, both mom and dad. So how do they fit this into like a work schedule and be committed to it?
Well, we've really thought about that when we designed the program, trying to make it at the best time during the week for them, and we try to accommodate around their schedule. So the program is at the end of the day, so really when we expect that most people will be done with work. Like I said, it's taking place at the birthing center, so you have a really nice room, really nice facility, and it's basically an investment. This is the name of the program, Healthy Beginning. At some point, you've got to take charge of your health. There's just no choice. And I personally think that there's no better point in a family life than when you're going to have a baby, when we have the attention of a family for 9 months to do exactly that, take care of your life. So the program is really a good chance to invest in your health, be able to get good lifestyle habit. We talk about smoking cessation, about exercise, which you can do when you're pregnant. So all those type of topics are covered. So I think this is worth making the time for it, although we have tried to build it so it's easy for family and couple to attend.
So who's on your team? Is it just you that's doing the Healthy Beginnings, or what does this look like
No, it's
for the
basically
patient?
Good question. It's basically all of us at Northwestern. So the three obstetricians, Dr. Fontaine, Dr. Sullivan, myself, the nursing staff, we're trying to incorporate all the services that that will touch a pregnant family in Franklin County. We also work with the Department of Health. We try to make certain interventions that will touch everybody, be present at that program. So no, it's everybody in Franklin County that's involved with prenatal care that we try to make part of that program.
So what about siblings? So sometimes if you're the only child and you've got a baby brother or baby sister on the way, how do you incorporate the family into this program, or are you thinking about that? I know it's new, but
it's brand new, so we're thinking about doing exactly that. And so far we've had some children who have come to the program. Ideally, it's not always easy because we're trying to focus on mom and the baby that's coming, but that's in the work, exactly.
So if someone is just pregnant, what advice do you have through this, this pregnancy period to maintain good health? Because you've already talked about staying healthy. So what does that healthy preparation look like? What do you recommend for folks?
Well, in a perfect world, you would be able to plan your pregnancy and do it before you become pregnant. Life is full of unexpected events, and definitely pregnancy is one of them.
It could be.
One of them, but in general, it's a good time to get good life habit, basic stuff. When you think about it, don't smoke. I mean, if you have any kind of medical problem, get it under control. Take prenatal vitamin, eat well, exercise regularly. See your doctor early in pregnancy. One of the benefits of that program is we see women very early, around 9 or 10 weeks. So we have a chance to do early intervention and prevention. So in general, it's a good time to put your health into order, where the name Healthy Beginning.
Sure. So you've had a group or two that's started already, and what's the questions that you're finding that are coming from the couples? What's kind of the most frequently asked questions?
Oh, everything. I mean, we've covered the way the program works is I do the first trimester, Dr. Fontaine is in charge of the second trimester, and Dr. Sullivan does the third trimester. So we each have our kind of topic. But, very common question. Exercise comes very, very often because I'm at the beginning of the pregnancy. Many women believe that it's not okay to exercise when you're pregnant. Many, many people still look at pregnancy as a disease. So they kind of, stop there. So we have a chance to talk about that a lot and place it in perspective for them. We've had a lot more than one group, by example, because this is something that happened every single week. So for the last 7 months, every single patient coming through our practice has been to this program once a week. So we are getting to our first week that is going to be postpartum shortly, but you're talking about literally hundreds of women who have been in the program so far.
That's terrific. Now, so have you gotten any feedback on the program?
Yes, everybody loves it. I mean, it's such a change that it's at the beginning difficult to get attendance because it's a new concept, but even now we can see that it has changed a lot. I mean, last week we had 7 couples that were present. The discussion becoming more dynamic, people are getting more involved. So I think with time and as the word spread out with events like now actually, it's going to be very, very exciting because that's the way to provide care. You want the people to be involved.
Yeah, exactly. And I think, you know, going through it together, you get new friends, and so you can share stories or or support group, you know, to help each other out a bit. So I think that is it's a wonderful, definitely a wonderful program.
And this was part of the goal, is to show the community what we have available at the hospital, where the physician, the nursing staff, all the Department of Health, all the groups that are involved with pregnancies can offer to Franklin County. So that was part of the goal, to know that when you face some problem, you're not alone, that we are here as a community for that.
Great, thank you. So I'm gonna, as we begin to wrap up, I just want to ask a question that I hear from folks a lot, is this whole thing about breastfeeding. And so I know some folks may get discouraged by it. So if someone's having a challenge with breastfeeding, with the latching, what do you recommend for folks at that point?
Well, I'll tell you the truth, I'm always very careful to make recommendations about breastfeeding, not having breast myself. I try not to teach, not from experience, but I remember when my wife was breastfeeding, you know, there's no doubt that breastfeeding is the best thing to do. I mean, when you think about it, it's free, it's available all the time, it's always at the right temperature, you don't have to purchase it. It has all the benefit from mom and baby.
Exactly.
We are blessed because at Northwestern we have a nursing staff that is, I think, highly trained in supporting for breastfeeding problems. So my answer to my patient have that problem, I usually refer them to the nursing staff, people who know what they're talking about. We also have a lot of our pediatricians that are very involved with breastfeeding. We have a lactating consultant. So we support breastfeeding a lot, and we have a lot of resources, and this class is also part of that. So Healthy Beginning will give a lot more information and support to women who are planning to breastfeed, to know that when they are a problem, they're not alone. The 2-week postpartum visit is going to be a big thing about this, because obviously this is the time when problem will surface.
Exactly. It sounds like a wonderful program, and I'm so grateful to have the program at the hospital and such passion to do the best for our patients. So speaking of passion, you've been doing this for 22 years. What keeps you so excited? I can feel it when you're speaking. So what keeps you so excited about this?
Well, 22, you're really nice, actually. I'm unfortunately much older than that. It's been 31 years, 22 years in St. Albans.
Okay.
But before that, but you're nice. I mean, it's really nice of you of saying only 22. I just love obstetrics. I mean, I think this is the best medical specialty. I mean, we have a chance of being part of a family most important event when they're having a baby. And honestly, there's no best time in life. I mean, I'll be the first to say that 8 times out of 10, you don't need a doctor to have a baby. Our role is really just to be there in case something go wrong. It's a natural, you know, part of life. But obstetrics is just neat. And practicing obstetrics here for the last 22 years has been a dream. I think this is just the best place to have a baby, point.
Oh, that's terrific. Well, thank you so much for your enthusiasm and for serving this community. We greatly appreciate that, and patients love you. So, so thank you very much.
Oh, man, it's a privilege, let's put it this way. And I apologize for my French accent.
No apologies necessary.
No apologies.
Well, that's great. Well, this is Jill Berry-Bowen. I'm the CEO of Northwestern Medical Center, and so grateful to have Dr. Trombley here with us today to talk about Healthy Beginnings, which really gets new moms and dads off to a great start with having a child. So thank you for joining us on NMC Health Beat.